Sunil Richardson. I'm a craniofacial surgeon. I practice out of South India and also out of the Middle East in the country of Oman. In this short video, I want to tell you about speech surgery. A lot of patients ask us about whether they need speech surgery, and more importantly, would this speech surgery improve their speech or would it be beneficial to them? Now, who needs speech surgery? Here at Richardsons, and more than 95% of our patients who undergo speech surgeries are patients who are born with cleft palate. So if there is a patient who was born with a cleft palate, no matter what the patient's age is, even if the patient has had multiple earlier surgeries, if the patient is not speaking as normally, as clearly as someone else, then they are good candidates for speech surgery. Does it mean that we are assuring them 100% results for all of the patients? No. But what we're trying to tell you is a lot of these patients can improve their speech, and a lot of them very, very significantly. So we have a very dedicated team here at Richardsons, which also comprises of me, speech pathologists and other specialists. A lot of the patients who come here, we first do the lateral fluoro videoscopy. I also take a look at how the palate is when it moves. We want to make sure they don't have any fistulae, because if they do, then the fistula needs to be closed. Today there are so many techniques out there that are needed to approach and solve the issue the patient has. I'll give you an example. Some patients might need speech therapy first, and some patients might need speech therapy only. Then there's another group of patients who would first need speech therapy. We would want to see what's the improvement, and then we would do a speech surgery thereafter, and then again speech pathology, speech therapy if it's needed. And for some people, I've seen speech therapy is good, but speech surgery is better. Because if you do not have muscles in the right position, if the anatomy is nowhere near normal, you have totally disrupted anatomy. No matter how many months and years you press on with the best of the very best of speech pathology, speech therapy, it's going to do you no good. So what's the message? The message is the role of surgery is very vital. It's very pivotal in order for speech to be improved. We perform a lot of speech surgeries here. We've got a lot of publications, some of the techniques that range from a modified furloughs palatoplasty to different types of pharyngoplasties to even fistula closures using alloderm and using PRP and growth factors. All of these aim at improving the speech. In short, what happens for these patients is that the muscles of the soft palate, the muscles that are lying in the roof of the mouth and behind are not moving well, are not sutured or restored in its normal form by the earlier surgery, and that's the biggest reason why many of our patients have speech issues. So we exactly find out where is the problem. We could also get a nasal endoscopy done and find out the portal opening between the movements of the muscles of the soft palate and the pharynx. So if this is a soft palate and this is the pharynx or the throat, the muscles have to move and touch behind. Unless this happens, very impossible for you to have good speech. You would have a lot of nasality. Speech itself is a complicated issue with many different aspects of speech in terms of pronunciation, nasality, and so on. But as a patient, if you have an issue with speech, if someone is not able to follow clearly, it could also be because your upper jaw hasn't grown enough. It could also be because you're not able to move your tongue well enough. So it's essential that a proper investigation be done and then a specific tailor-made treatment plan made for the patient. We have done speech surgeries for hundreds of patients here at Richardsons in the last decade and a half. We've got excellent successful results, and we highly recommend that patients who have this kind of issues come to us for a personal consultation, because we would need to assess the speech and do a lateral fluorovidoscopy, if needed a nasal endoscopy and a cone beam CT scan, and then we can arrive at what the best treatment modality would be. How long does this all take? Yes, it takes a little bit longer than the usual type of surgeries because speech surgery is usually done 4 weeks after surgery, and that can go on for a few months. Typically, patients stay at a hospital for 3 to 4 days after speech surgery, sometimes even 3 days. Not more than 5 days generally. They then tend to go back home. A lot of them have some sutures that we put in, stay up to 4 weeks. Once that goes off, they are also requested to come for a consultation, and if they physically can't, then they can send us pictures or videos via FaceTime or WhatsApp. So anyway, they have to get in touch with base again, and then we take on to the next level of speech therapy. So I think the important take-home message is that if you're a cleft palate patient, and if even after having multiple number of surgeries and whatever your age may be, if you're not having the best of the speech you think you're having, if you think you want the speech to improve, then definitely we think we can help you. Thank you.